Hi everyone, in this second video, I'll be sharing with you some important points on entering cataract surgery data on Medisoft. We'll be focusing on three important points, namely posterior capsule rupture risk stratification, enhanced cataract surgery data input, and finally how to set individual surgeons' default. The PCR risk stratification tab is an important part of cataract surgery data entry. In 2009, Narendran and al. Devised a simple method for calculating composite risk for PCR for any individual cataract operation. This can be used preoperatively for surgical planning and also to assess complication rates in cataract surgery, taking into account complexity of case mix. This tab can be easily accessed by clicking on the hyperlink on the patient's homepage, as shown by the red arrow. On clicking the hyperlink, a window is generated with the PCR tab. When completing the risk stratification, it is really important that all questions are answered for a composite risk to be calculated. As an example, a 94-year-old patient with glaucoma, diabetic retinopathy, and a mid-dilated pupil with no other risk factors will have composite risk of PCR of 4.21% when surgery is performed by a consultant, increasing to more than 15% when performed by a trainee. The PCR tab should ideally be completed prior to surgery as a risk assessment tool. For this reason, the tab logs out after the main surgical entry has been entered, disallowing retrospective entry. Once the PCR tab and main surgical entry has been entered, this can still be reviewed in the future. This is done by first clicking on clinical visits on the patient's homepage and subsequently clicking on the date to come in entry within that page, as shown by arrow number 1 and 2. Moving on to enhanced cataract surgery data entry. Within certain NHS trusts, performing additional steps in cataract surgery, for example using iris hooks, Malyugin ring in patients with small pupil, will lead to the surgery being considered as enhanced cataract surgery. It is important to document this as it attracts a different payment tariff to the trust for the surgery. Additional steps may be documented as follows. Step 1. Click on the surgery button as shown by this red arrow. This generates a window. Step 2. Select pupil/iris from the drop-down bar here. Finally, step 3. Select insertion of iris hooks or ring pupil expander from the second drop-down bar and simply click Add here to document the additional steps taken during the surgery. In the final part of this video, I'll show you how to set individual surgeon defaults. One of the common barriers to good data documentation is time pressure. By setting surgeons' defaults, one can save time inputting data during a busy operating list. Firstly, click on the admin button here. Then click on the surgeon defaults and this will bring up a window as shown here. As can be seen, surgeon defaults can be set for a wide variety of operations. Not all sections need to be completed, but those done will be inputted by the system for any subsequent surgery performed by that individual. I hope you found this video useful. Thank you for listening.